I'm Dr. Bhupendra Ahuja, and I'm the president of Indian Radiological Imaging and Association, and I belong to Agra. As far as the journey of radiologists is concerned, let's start, which was started by the Ronjan in 1898, and since then, the Radiology Association was formed in 1937. Gradually, we are becoming more and more advanced as the technology is improving. Initially, when we started, definitely there was only X-ray, and we were not a very good position. We were just considered as a technician, but now, or a darkroom person. But as the technology is improving, the ultrasound gave us in 1970 gave us a more clinical radiological situation, where we used to do ultrasound by own and interacting with the patient while doing the ultrasound, and that gradually technology further improved. We had the CT scan, and finally we have the MRI scan and the PET scans. So with these technologies, so radiological, as far as the association, as far as the subject is concerned, it is becoming more and more interesting, and now the stage has come where not a very good students were opting for the radiology. Now the stage has come, the toppers of the batches, toppers in the field, medical fraternity, are opting for this particular field. So that's, I feel it's a good jump we radiologists have got, and as the more intelligent persons are there to express, to have their knowledge, so that's, I believe it's a good achievement we have now in this field. Yes, as the technology is improving fast, so we have to be with the technology. That's the biggest challenge, I believe, because if we are not moving with the time, not moving with the technology improvement, we will be left behind. So I believe as a radiologist, that's the biggest challenge, because if I don't attend these such conferences, if I do not update my knowledge, I think in any radiologist will feel obsolete in 4 or 5 years' time. So that's the biggest challenge, that we have to update our knowledge, we have to go with the time. That's the most important, because things are changing very, very fast, and technology is being improved very fast. The second challenge as a radiologist is, I believe that the issue which now has come up of the PCPNDT Act, because when we started, the government introduced this act, the motive was to improve the sex ratio, but unfortunately as the time passed, the implementation had taken a different way. They are more going in the clerical issues. The authorities are more looking into the clerical issues rather than focusing to improve the sex ratio. This is one. The second, I believe in PCPNDT, is the society problem. We are not able to improve the thinking of a society, which is very important. Until and unless we improve the thinking of a society, it will be very difficult to improve the sex ratio. Of course, I will not say there are not black sheep in our association or in other radiology, other association as well, but we have to sort out that problems. We have to pinpoint those black sheep, and we should keep them away from our association. Only then we can have a very healthy relationship, and we can improve the sex ratio in our country. And definitely the authorities, the various associations who are involved doing in the ultrasound, have to go hand in hand, and we have to work together so that we can achieve the aim of this act as such. It's a long journey of our association. It has come long way. The stage has come. We have got as far the scientific content is concerned of our association, of our conferences, it's almost at par with the international associations, international conferences. I have got no doubt about it. The way our residents are coming up, they are bubbling with the knowledge, they are attending these conferences, they are presenting their papers, and they are very good in, as far the content is concerned, as far the presentation is concerned. And my vision would be to encourage these residents more and more. So that is why our association is started 4 CMEs, that is continuing medical education programs in various subspecialties. Like in this particular year, in 2016, we are going to have 4 subspecialty continuing medical education program. One is in the neuroradiology, the other is in the body imaging, third is in fetal medicine, and fourth is in the musculoskeletal radiology. So similarly, we are going to have 2 programs, education program for the residents, and we are also in touch with the National Board of Examination, so that their DNB students can also be part of our resident education program. This is our right now in the first agenda, to educate our residents more and more, so that they can do a better service to the humankind. Then second is to improve the scientific content of our association, to improve the standards of our conferences as far as the scientific part is concerned. And the other thing is to have a better, now another thing which I am trying to develop in our association is better relationship with the international, other international radiological associations. This is what we all are planning, like the RSNA, we have got European Radiology, and the AOCR. So these we are trying to develop better relationship, so that we can have a good exchange as far as the technology is concerned, as far as the knowledge is concerned. We can have a better exchange of the faculty, so that we all can be benefited with this. Then another thing which is I'm trying to bring to this association is that we all should have more the fellowship also we are trying to introduce, so that somebody wants to have a specialized, focused knowledge in one particular subject. So we are trying to have fellowship of 6 months or 1 year, so that they can do subspecialties in our recognized or government recognized institution, and they can be super specialist as far as the radiology branch is concerned.